and I had over 2,000 miles to go to the next oil change. So, maybe those were indications.
Yeah. Okay. So I'm just going to leave this right here. And I'm going to bring this down a bit. Right here. That means I'm going to kind of stay in the middle, somewhere up in here. Okay, fantastic. So I'm going to have my book right over here. Oh, come on, really? Not right now. Not right now. Okay. All right, you guys. So today we're going to talk about Chapter 2 out of the Chabner Medical Terminology book. And want to say good morning to everyone and thank y'all for coming and thank everyone for tuning in on YouTube. And to all my other college students, you're more than welcome to listen in. And this also will coordinate with your Shylin book, okay? I'm going to get me one more chair as a podium. Use this one. I got it. All right. Sweet, thank you. Okay, I don't have to hold this unless I like to talk with my hand. Okay, so we're going to talk about introduction to body systems, body cavities, divisions of the back, and I'm going to write y'all my YouTube account so that you all can review my YouTube account at your leisure. Let's see if I get it on. Okay, it's on this side of the border. So it is THCOD, and it has a lovely flower icon, red flower icon. And THCOD means Tara's Healthcare Consulting and Office Design. Okay, and this is Ms. Harper's personal YouTube channel. I have created this YouTube channel for all of my students who are going into the health field, for all of you who may not be necessarily majoring in health information technology or health information management. However, this may be of some great help to you, to your business or your career in some fashion or form. Okay. All right. I keep getting these lovely pop-ups, which I'm not going to deal with today. All right. So we're going to talk about body systems, body cavities, division of the back, planes of the body, and also, of course, terminology. Then in person, we're going to talk about CT and MRIs. And then there are some exercises, some answers, some pronunciation of terms, practical applications, picture show review, and terminology checkup. Okay. So again, to my health information technology students, AKA meaning my medical business office students, my medical building coding students, you're all are one and the same. It just depends on what campus you're located at, where I teach. However, the importance of you learning medical terminology for your field is that you need to know the language. Remember I said medical terminology island, okay? And a medical terminology island, everybody has to understand the lingo, the language. If you're going to be a healthcare worker, a nurse, a doctor, physician, anywhere in the health information or health information technology management field. And so it's real important because as a medical business office professional, being that a medical coder, a medical biller, you have to understand the dictation of the notes. You have to understand what's going to be in the SOAP notes. So SOAP notes is the same as progress notes, okay? And so that's why you have to understand that. If you're going to do coding, coding is the first thing in the process of adjudication. So we're going to talk a little bit about adjudication process of billing, and so that you can understand where in your role is it important for you to know that. For coders, you have of the body, the different body cavities, so you can understand when you're coding for surgery. Let's just say, for example, if you're coding for surgery and that doctor is going in to do bariatric surgery, okay, and he's going in through different ports. Or my bariatric surgeon, I'll be open to say that my first bariatric weight loss surgery, he went in through my belly button. Okay. And through the belly button, he was able to remove 75% of my stomach. So I only eat and function on 25% of a stomach, okay, which is about big as a pinky here. It stretches a little bit, but then it retains back. If I overeat, it's going to be an unwanted picnic. And I don't think anybody wants to see a unwanted picnic, is what I call it. And so somewhere up in that laparoscopic procedure, because he's probing around laparoscopically, he's pulling those things out concerning the bariatric surgery, he may see some other things going on that needs to be dealt with. Okay, and maybe prior to, he may see that, okay, within the line of his practice, let's suppose Ms. Harper has gallstones. Okay, not only is he going to deal with removing 75% of my stomach, he's going to also remove the gallbladder, okay, because he sees that I have gallstones there. I've been having a lot of gas and belching and pains and sharp pains and stuff. So to keep me from having problems down the road, let's go ahead and just remove that. And normally that's what they do. That's one of those side effects to weight loss surgery. But I haven't had that challenge, but I'm just giving you an idea. So when you're coding for such a thing, you're going to code for on the professional side. Now there's the professional side and then there's the hospital side. Okay, so when we get further along in the Fortney books, you're going to learn about chapter 7. Chapter 6 is going to teach you about diagnosis codes and procedure codes. And I'm going to bring y'all some ICD CPT books for y'all to use in the class. And they're only to use for the class, okay? And then once you understand how to use that, then you're going to understand how to utilize a CMS 1500 form and how to utilize a UB04 form. A CMS 1500 form is for the physician's office, okay? A UB04 form is for the hospital. Now, for the hospital, it depends what you're coding for the hospital. Because if you're going to be an acute care coder, you're going to utilize revenue codes. That's a whole nother conversation. Okay, we'll talk about that later when we get to it in Courtney. I think that's going to be chapter 8. When you're doing professional coding, you're going to be using your CPT book. You're going to be using your diagnosis book, your ICD-10 book. Okay. Now, when a physician codes does work at a hospital, such as surgery, you got to code, you, the biller at his office, you got the code for his handiwork. Okay. What I mean by handiwork, he's a surgeon. So you got the code for the work that he does. You got the code for when he makes those beautiful hospital rounds to come see you. How you doing? Did the nurses take care of you? Did you pass gas? Do you have fever? Anything else we need? Are you still in pain? You know, things of that nature. They see you and they may bring a whole class of residents with them that's rotating and learning how to be physicians in the classroom. I'm sorry, in the hospital room of that patient, and they move on. Okay. And so that's $245 for 15 minutes to say, hi, how you doing? Y'all, do y'all see how I'm talking to her? Okay. Do y'all see how I'm noticing her chart? Do y'all see? Okay. And so that's the beautiful thing. So from the hospital, when the coders at the hospital, they're going to, the transcriptionist, everybody plays a role. They're going to send, the transcriptionist going to send the operative report back over to the hospital scheduler. Remember, we talked about different jobs, different roles of the hospital and how billing is done. And they're going to receive the operative reports. You as a coder are going to take those operative reports and say, okay, he saw this patient. He did this type of procedure. Oh, he also found that he had to do removal of the gallbladder. Okay, so, and it was all done in one opening. So let's take a look at that, and then it's going to all make sense to you. So one opening, this belly button. This is a belly button. Okay, so I'm talking about me, by example. Okay, and he went in and he removed 75% of my belly. Okay, so this portion got cut. Okay, this portion, I'm going to color it in red. This portion got cut. So all you see right here is just a, and let me just do it like this. Okay. And then it got cut and it's got sutures. And so there it is. So my stomach now looks like a very long esophagus. Okay. And all right, looks like a very long esophagus. Now, on this side, you have the fundus, okay, the body belly, okay. You have the esophagus and you have the fundus, and over here underneath the body belly, you have the gallbladder, you have the pancreas, okay. So let's do this. I love color, okay. Okay, so we have the gallbladder over here, okay, and then we have the pancreas, maybe, I think it's somewhere near around here, kind of odd in shape, okay, and so we're going to name this gallbladder, okay. I'm not drawing a good picture, but you'll see in your book eventually, okay, and then the purple is the pancreas, okay. All right. Okay. Now, he removed 75% of my stomach. Okay, so 75% of stomach removed. Okay. So that leaves 25%. Okay, at least 25%. Now, let's suppose that Ms. Harper has some gallstones there. Okay, so he's now going to also remove the gallbladder. Okay, and he's doing this all from the same opening. Okay, all from the same opening. Okay, now as a coder, okay, you're only going to code for a one-time opening. For a one-time opening, okay? That one opening is sufficient to get whatever organ or whatever that needs to be removed, polyps, whatever that may be, okay? Appendix, whatever that may be, okay? One-time opening. Not like I'm going to charge an opening for the stomach and I'm going to charge again for the opening for the gallbladder. Because let me tell you right now, that's going to get rejected. Okay, it's called global. Okay, all this goes under what we call global billing. Okay, and then when it comes to the other side, we're going global. When it comes to the other side of the insurance company, then we're going to do global pay. Okay, now between the both of these, this should give 3 free follow-up. FU means follow-up, not the other FU. Okay, I want y'all to keep your mind clean. Keep your mind clean. Come on now, keep it clean. Keep it clean. Thank you. 3 follow-up office visits. OB means office visit. Remember, ladies, that we on medical language island. So you're gonna have to learn my language. Okay. Once you learn my language, you're gonna be just as fluent as me in speaking medical terminology because we're on medical terminology island. Put it somewhere soft. I hate when it does that. Okay. All right. Now, you're probably saying, well, Ms. Harper, how is this making sense to the book? I'm glad you asked. Glad you asked me. Okay, because you have to. Have y'all ever seen that show called The Good Doctor? About this doctor that be on Channel 13, comes on Monday nights. It's one of your shows. It's one of my favorite shows too. And it's a doctor. He has autism. Okay, but he's highly intelligent. There's several different spectrums of autism. Okay, and the type of autism he has, he's like highly intelligent. You know, they're like those one-track kind of thinkers. You know, when they stuck on something, they like kind of like OCD in a way, and so they can't move forward until they deal with that one thing. But their mind is just, to me, just super brilliant. Okay. And so when he thinks about when he thinks about a case, okay, when y'all get those operative reports from the doctor's offices, from the hospitals, those are called cases. Okay. When y'all get ready to learn how to code in the second half of the comprehensive coding systems class, you're going to learn how to code cases. Okay. And some cases are long and some cases are like that. Okay. But he can picture in his head, where is that located and how does that work? And I see the anatomy of the stomach. I see the anatomy of the gallbladder. I see the anatomy of the pancreas, but the functionalities, how each one does what it does and how all of it woven together and do what it do. And if I do this, take away that, how is it going to affect the rest of these type of systems of the body? Because remember, I said, how many systems of the body is there? 13. That's my opinion. However, formally from Matt 12. Formally in the book is 12. Okay. And so he imagines how this stomach works, and if I cut this off, then it's going to make the other systems of the body overcompensate for something that's missing. Okay. So you are going to learn how to picture something and how to know how to code it. So one-time opening. So let's just get us a surgical code. And I have to remember, my night class know about procedure coding, but I'm gonna give y'all a procedure code, okay? Procedure codes are 5 digits. So let's suppose removal of the stomach. Okay, we're gonna call it gastrectomy. Okay, tomy, removal. Okay, removal. Okay, so we're dealing with that, taking away the stomach, which is what? How much I said? 75%. Okay, and we're going to also remove the gallbladder. So what is the medical terminology for the gallbladder? Does anybody know what that is? I think it's called cholecystectomy. Thank you, Dr. Smith. I'm trying to spell it, you all, so please. ISTO. IS. Okay, hold on, let me move this. Okay. Cholecylysa, something like that. It has an extra word in it. Ectomy. Okay, and if I spell it wrong, forgive me, okay? I'm just talking right now. Okay, so that's going to be removal of the gallbladder.
I got it for you.
Okay.
CHOL.
CHOL.
EC.
Okay, hold on. Let me take all this out. EC.
YST.
Thank you. Okay, thank you. Removal of the gallbladder. Thank you, Dr. Smith. Okay, now, and I'm going to also laparoscopic. Okay, a laparoscopy. No, not laparoscopy. Laparoscopy. Okay. All right. So I'm going to charge, and on your CMS 1500 form, you have 6 lines. So you have line 1, line 2, line 3. Okay. And so one opening, laparoscopy, to initially go in to remove the stomach. And by the way, it says on the operative report that he removed the gallbladder because he saw gallstones. Okay? You see how important that is? So you have to kind of picture it and say, I can't charge a double opening for 2 different things if it was done within one blow. That's how I'm going to put it like that to you. If it was done in one blow. Okay? I hope I'm making sense to you. Okay, now let's turn the page here to page 48. I've been ripping out of my book because I've been making pictures and accommodating, and I don't mind accommodating. Bless your hearts. I was a college student myself. Okay, so introduction. It says, all parts of your body are composed of individual units called cells. So, for example, are muscles, nerve, epithelial, which is skin and lining of the internal organ and cavities, and bone cells. Similar cell groups together are called tissues. Groups of muscle cells are muscle tissues, and group of epithelial cells are called epithelial tissues. Now, let's speak of epithelial cells for a minute. Have y'all ever brushed your teeth in the morning, and sometimes you be in a hurry and you might brush up against the cheek of your mouth and you kind of like, what is that? And you might get the kind of pulling out and this like stringy tissue. Okay, those are epithelial cells. Okay, and so by example of those epithelial cells, they tend to heal, they tend to repair really fast. Okay, because the salivation in your mouth, the moisture helps it to reconstruct, rejuvenate. Thank you, rejuvenate itself. Okay, regenerate itself. Yeah, rejuvenation is very important. You scare somebody out your face. No, it's kidding. Dry mouth. Okay, but anyway, it's really important. Okay. I bought my husband some of that biotin. I have to use it because I take like 6 to 7 different pills. Well, the mouthwash, the spray, you could take it with you in your purse or your briefcase, every now and then just kind of freshen up, It's not so much a breath freshener. It's really important, because if you have dry mouth, it'll dry your gums. It'll cause other things to happen to your teeth. And before you know it, you're at the dentist's office a little bit too soon. Okay. And that's only recommended for those that in my opinion, and for me, because I take chemo pills and stuff.
And
so
for your pharynx tissues down through that area also.
That's right.
Your voice box.
That's right. That's right. Absolutely. That's right. Thank you. Yes. And so those are called epithelial cells. And earlier on, I don't know if anybody else, but when I was stressed, when I first started college, I used to get canker sores. Anybody ever had canker sores in their mouth? Yeah? Okay, you've had it. Yeah, with braces. Okay, bless your heart. So it made it hard for you to drink orange juice, anything acidic, or tomato juice, things of that nature. So what that comes from is when you're highly stressed and you don't deal with stress very well. And when I mean I deal with stress very well, it's like exercise, whatever it is to relieve that stress, it tends to come about. Now, I was a very avid, active person in college. So I played tennis in high school. I played some tennis in college, not for scholarship, just for fun to kind of keep up with it, keep up with exercise. And then I would exercise, like 2 or 3 times a day on campus. And for some reason, I would still get stressed out because my freshman year, I'm still trying to adjust. Campus life and college life is much different. And I think it could be highly overrated if you're not coming into it smoothly. But I had to use some canker sore medicine. They now have canker sore medicine over the counter for people to deal with that. Okay, so bless your heart, I understand. All right, so collections of different tissues work together are organs, and organs such as stomach or specialized tissues such as muscle, epithelial, nerve help the organ function. Group of organs working together are systems of the body. Now, do you see how they have this beautiful chart down here and how everything comes together? It's kind of like adjudication of the body system, how everything comes into its form. Okay. And okay, so again, oh well, book says 11. I say 12. Okay, I don't argue with you. The body system. So you have the circulatory system. And in the circulatory system, you have the heart, the blood vessels such as arteries, veins, and capillaries, transports blood containing all type of blood cells throughout the body. Then you have the lymphatic system. The lymphatic system deals with lymph vessels and nodes that carry clear fluid called lymph. Lymph contains white blood cells called lymphocytes that fight against disease and play an important role in the immunity. Then you have the digestive system that brings food into the body and breaks it down so it can enter the bloodstream. Food cannot be broken down and is then removed from the body at the end of the system as waste. Organs in the digestive system include the mouth, the stomach, and the intestines. Now, mastication. Who all know what mastication is? Anybody have an idea what mastication? You know what mastication is, Dr. Smith. I know you would know, but I'm gonna ask the students. I know it's a horrible term in such a way. Mastication is chewing. Very good. It's chewing. Okay. So you have to masticate 25 times before you swallow. That is the proper way of chewing and swallowing your food and digesting your food. Okay. A lot of us, how many of us drive and eat? Always eating on the go. Yeah, I'm guilty too. I'm guilty too. Okay. And so when you're eating that hamburger, that chicken, that original recipe, I mean, it just lip smacking, that Popeyes just want to spice you in your face. Okay. And you like, if you're not paying attention, but you hurrying up and eating, because the speed of your brain is going along with the speed of the driving, right? And you're chewing and real fast before you know it, you kind of through with that food in a minute. Now, this is what happens. You taste your food, but you haven't really thoroughly enjoyed your food. You're eating it. You could feel the content of you, but you're really not full. Okay. And so it can cause you to overeat. Okay. And then at the same time, you're sucking in air. Now, what happens when you suck in air and you're eating and driving and you're drinking your tea or your soda, or your coffee, your orange juice, Slurpee, icy, and you're driving? What do you think? You're going to get gassy up here in the stomach. Okay. And it's not going to feel good. And then it kind of spreads in your back. And it's like, oh my God, I need a heating pad. And that's not what you need, baby. You need some Tums. You need some Rolaids. Okay. And then what ends up happening is you getting out in the parking lot, you parking in the parking lot and you walking. And as you walking, you beep, beep, beep. Anybody know what beep is? It's that seep of the gas. It's not quite that musical, Sarah. Okay, they quite that musical. Okay, I'm being nice. Beep, beep, beep. Okay, so it comes out, and you're like, And then you wonder why people walking like this, and you're pretending like, I don't know where that came from. I don't know. You notice that too? I know that was awful. And they notice it gets stronger every time they get close to you, and the smell gets stronger. Okay, and so I've had that to happen. I'm like walking and eating in the grocery store, and I'm like, ooh, and I'm hearing them going to another aisle because I don't want nobody to know. And I'm like, Lord, forgive me. I don't mean to do that. It just happened. Oh, but I feel better now. I'm so sorry. Okay, so stuff like that, it happens. Okay, so that's what happens when you shouldn't eat and drive, you shouldn't drink and drive. I'm talking about soda. I'm talking about soda, tea, punch, slush, icy, that stuff. You shouldn't really do it, but you can't do it because we live in a fast-paced society. We always have to be on the go. Okay, so just be aware. Don't be sitting up in church and you done had breakfast, rushing to get there, and he preaching, and you getting up, yeah, and you're like, and everybody knew it is like, ooh, it's the devil in here. Somebody got delivered. Yes. Oh my goodness, that's an awful deliverance, but okay, come on, bring it. Oh my goodness. Okay, so just had to kind of humor that up a bit, but it's the truth. And God knows I had to I ain't getting up. I'll be like, amen, sit right here. Amen. I am not, y'all do not want me to get up. I promise you, you don't. Okay. The next thing is the endocrine system, which composed of glands send chemical messengers called hormones into the blood to act on other glands and organs. So, for example, the endocrine glands or the thyroid gland, okay? The adrenal glands, which is right up above your kidneys, the pituitary gland, okay? Then you have the male and female reproductive systems. Okay. So again, in my opinion, it's two different systems, but it's all part of one it's all part of one system, but two different kinds of systems and functionality. Female and male reproductive systems, which produce eggs and sperm, cells, which is egg and sperm that join to form an embryo, which develops in the uterus of a female. Male testes, female ovaries, the sex organs produce hormones as well. Okay, so a lot of times in that area, men can get breast cancer too. They really can. And their genetic makeup can be a little bit different. It's called gynecectomy or I forgot. Where men may develop some sort of breast tissue in an abnormal way. Men that are born with Klinefelter syndrome can also get breast cancer. Okay, just like women. And so a lot of times for women, I speak for women, I know more about the women's side than I do men. When I had my right breast mastectomy and I had to go through chemo, it stopped my menstrual cycle. It stopped the hormones of the estrogen, and that's what helps give the menstrual cycle and those beautiful pains that we suffer. Okay, she goes, yes. And so what helped me, whatever a woman goes through down here in her female reproductive area, it affects this up here, if you notice. So when we have menstrual cycles, your breast gets tender, your nipples get enlarged, and you telling your husband or your boyfriend, don't touch me right now, I'm real sensitive, I don't like that. Your pheromones are like on high. They just find you just utterly attractive, and it's like, I'm not attractive because I'm velvet red right now for 2 weeks, and how do you find me attractive? I'm not feeling attractive, and so they go crazy. So something like that is like, they just they could just pick up on your pheromones. Okay, all those beautiful hormones, and then whatever goes on down here to fix it up here, whatever goes on up here to fix it down here. And so with me, I was I want to say her positive. So I ended up having a total hysterectomy. So it lowered my chances even more of the cancer coming back. So, and I still take chemo pills to this day for 10 years now. But I'm grateful. So it just lets you know whatever, even if you get ovarian cancer, uterine cancer starting off, sometimes this may affect this. And all of a sudden you find out, oh, now I got breast cancer because these two play a role with each other. Okay. All right. So moving right along, we have the musculoskeletal system, which consists of the muscles, the bones, the joints, other connective tissues such as cartilage that supports the body and allows it to move. This is the system where you work for an orthopedic doctor, okay, or a sports medicine doctor, okay, if you want to do coding for that. I used to be a medical biller and coder for orthopedics department back in my youthful days in the early 90s, telling my age. And so I enjoyed it. I love it. The nervous system, which carries electrical messages to and from the brain and spinal cord. Okay. Now, this is also for those that want to deal with um, coding in that specialty. And they also do what they call sleep tests. I forgot that kind of sleep test, what they call that, ECG, electroencephalogram, EEG, electroencephalograms. Okay. Then you have the respiratory system, which deals with the breathing, the process of which air enters, leaves the body. Organs of the respiratory system includes the trachea, the windpipe, the bronchial tubes, and the lungs. Then you have the skin and sense organ systems, which includes the skin and um, eyes and ears, receive messages from environment and sends to the brain. The retina is the layer of the sensitive receptor tissue in the back of the eye. And then you have the urinary system, which produces urine. It sends out of the body through the kidneys, the ureters, the bladder, and the urethra. And remember, some time ago, we talked about that, how women are more prone to get urinary tract infection and men are not. Okay. You have some men that may get urinary tract infections, which is very rare, but it's only because they were not circumcised or they don't clean themselves very well down there. Okay. And sometimes you can tell when a man has not been circumcised because if they don't keep themselves clean and they skin pulled back and all that, they tend to give off a smell. Okay. And that has happened before that I've noticed. Okay. Now, the next part of the page here are the body cavities, okay? The body cavities. So we have the pituitary gland, we have the breastbone location, the diaphragm. So we have to label all of these body cavities. Okay, so let's look at number one, that body cavity. Okay, so what is number one, that body cavity called? The cranial cavity, and it's located in the head and it surrounds the skull, and it's cranio. Okay, so you may want to highlight that. The cranial cavity contains the brain and other organs such as the pituitary gland and endocrine gland located below the brain. Now, number two, you have the what? Thoracic cavity. Okay, the thoracic cavity. So in the thoracic cavity, and so it's thoraco. It means chest. It is surrounded by the breastbone and ribs, the lungs, the heart, the windpipe, which is the trachea, bronchial tubes, including the trachea to the lungs, and other organs in this cavity, okay, thoracic cavity. So again, if you're going to be a coder dealing with neurology, working in the neurology department, then you're going to mostly deal with the cranial cavity, and you're going to also deal with the spinal area, the spinal cavity, all those wonderful things that's dealing with the nerves. So that's going to be your area of where you live, okay, in building and coding. Thoracic cavity, if you're going to be a coder for respiratory, you're going to be a medical coder for cardiology. That's where you're going to reside. You know, all the codes and building that deals with that. All right. So the next one here The lungs, which are surrounded by a double membrane, is known as the pleura. Everybody say pleura. Pleura. Okay. The space between the pleural membrane is called pleural cavity. Okay. A large area between the lungs is called the mediastinum. So right here, the mediastinum is right here in between. Okay, the breastbone here. Okay, the mediastinum. Okay. Now you have the heart, the esophagus. I'm sorry, is that the sternum? I think that's the sternum. I got that wrong. I'm sorry. The heart, the esophagus, the trachea, and the bronchial tubes are organs within the mediastinum. Yes, the sternum is the breastbone between, okay, that sits on top of the heart. And we'll talk about CPR and how that goes. The mediastinum is something different, so my apologies. Okay, so now we have the abdominal cavity, which is the space below the thoracic cavity. The diaphragm is the muscle that separates the abdominal and thoracic cavities. Organs in the abdomen include stomach, liver, gallbladder, small and large intestines. Okay, so now on page 51, we see this lovely picture of all of its labels and everything that it's talking about. So we're going to go on to page 52, and it's giving some more labels and things of that nature. Okay, so we're going to move around a little bit more to page 53. And so it says, ask a quick review of the terms presented in this section. Match the term with its meaning and write it in the space provided. Okay, so let's say these terms together. Okay, well, repeat after me. Say abdominal cavity, cranial cavity, diaphragm, mediastinum, pelvic cavity, pelvis, peritoneum, pleura, spinal cavity, thoracic cavity. Okay, so we're going to come back and revisit page 53. So I'm going to have you to work on that after we come back and revisit that. Let's go to page 54. And it talks about the division of the back. So you have the spinal column. You have each part of the spinal column is called vertebra. Say vertebra. Okay, and if it's two or more bones of the vertebra, it's known as vertebrae. So vertebra is singular, vertebrae is plural. Okay, all right. So a piece of flexible connective tissue is known as disc. Say disc. Okay, and it lies between the backbone. The disc is composed of cartilage and is a cushion between the bones. If the disc slips or moves out of its place, it can press on the nerves that enter or leave the spinal cord, causing pain. Okay, so let's look at how many bones it is per part of the spine. So the cervical part, which is the neck region, has 7 bones. So in the cervical region, you have C1 to C7. Okay, now notice that C1 to C7. If you're working for a back surgeon falls under the line of an orthopedic doctor. Okay, he's an orthopedic doctor, but he's specialized in back surgery. When I worked in orthopedics doing billing and coding for them, Dr. Waters, and I could say he's a great back surgeon. Great back surgeon. I mean, he sees everything else, but his love was back surgery. Okay. And I would say if I needed back surgery, God forbid, he would be my back surgeon. William Waters. Dr. William Waters. Okay. I think he was, the last I knew, he was with the Kelsey Sebo Clinic. And I think he also works with Fundren Orthopedics. Yeah, Fundren Orthopedics. Nice, tall man, very nice. And so he was not my back surgeon, but he was the doctor that I worked for, and I did billing and coding. And everybody would ask for him. So why you're probably saying, well, Miss Harper, why are you mentioning this? I'm glad you asked. I'm going to, let's see, I'm going to erase this. Did anybody get this here on the board? Okay, so I'm going to erase this. And y'all have to forgive me for sitting in a chair. I've had a guy, so I'm doing a lot better today. I was on my walker yesterday going to church. So I take my medicine and I rested really well. And so I'm trying to kind of stay off my right big toe and my ankle because it still kind of hurts. Okay. All right. So let's look at this. So you have C1, C2, C3, C4, C5, C6, C7. Okay, so I'm not the best drawer. I'm sorry. I'm just going to draw the best that I can here. Okay, so this is the back. Okay, I know everybody's back don't look quite okay. Let me do this. It looks like somebody in pain. And I'm not trying to draw them in pain.
We're not laughing at you. We're not laughing.
Okay, thank you so much. And I'm like, oh my God, it just looks like somebody in pain. Okay, so this is the cervical area. Okay, all right. So when you look at the SOAP notes, remember I talked about SOAP notes last week? SOAP. Where does your job live? If you're going to be a biller and coder, where does your job live? A mean. What is it? Assessment. Very good, Dr. Smith. No, just kidding. Oh, you didn't do that? Okay. Very good, Shalay. Shady. Thank you, Shady. Okay, so it's assessment. Okay. What is the abbreviation for diagnosis? DX. Okay. What is the abbreviation for procedure? PX. Okay, very good. Okay, if you're going to be a medical biller and coder, this is where you live. Okay, now what does S mean? Subjective. Okay. What does O mean? Objective. What does P mean? Plan. Okay, and subjective, whose conversation is going on? Who's talking?
The patient and I guess the person registering.
Okay, patient and, well, you can say medical assistant or nurse. And that nurse can be the RN or the LVN. Okay, depends on who's rooming the patient. Whose conversation is going on in objective?
Patient and physician.
Patient and the physician. Okay, what's going on with plan?
Is it that I guess what they're gonna do?
What is it?
Not the operation, but basically the routine or the diet. Procedure.
Routine. Well, you said diet, so it could be diet. It could be talking about return to office. Okay. It could talk about maybe he's coming back in 2 weeks. It could talk about, what does RX mean? Prescription. He's going to get a prescription. He's going to return back to the office in 2 weeks. Okay, so that's what that is. So what is another name for SOAP notes? I don't think I've talked about that, so I'll go ahead and give it to you. It's called progress notes. Okay, progress notes deal with the dinosaur age, okay, which is paper-based medical record, okay? This right here, soap notes, is more what you need to know for electronic medical records. So the doctor put on there that he saw the patient and he did a spinal tap on C1 through 7, okay? Or he may have done a neck manipulation of some sort on C1 through C3. You're going to see that written under the assessment part. Are y'all getting this? Okay, very good. Okay, so I had to write it out like that. So now, how many bones are there in the cervical part? Okay, now let me say this so I can unconfuse your mind. There is the cervix down here in the reproductive area, okay? And that's like the neck of the uterus, okay? Well, then we're talking about the neck of the spine, okay? So please don't get confused. Recognize where you are, what department you're working in. So when they're talking about cervical, you know, you're not getting it confused, saying cervical cancer, why am I working in neurology? Kind of think for a minute, like, oh, this not neurology. Hold up. Well, oh, girl, I'm tripping. I'm in OBGYN. I'm tripping. Okay. All right. So I just had to kind of say that for a minute. All right. So thoracic. Thoracic has 12 bones. So you have T1, T12. I'm not going to write it all out, but I think you get the idea. I think that's kind of like right up in here. T1 to T12. Okay. Now, if you're going to work for a cardiology doctor and he's going to tell you that he had to open up the thoracic area or the thoracic cavity, or he's a thoracic surgeon, okay? He had to go in and do some manipulations in the back, you know, in the thoracic, that's the backside of the heart, the backside of everything that's in the thoracic cavity, okay? So please recognize that that's where you live. The lumbar region, okay, which is the loin and the waist, okay, that's 5 bones, okay. I think this is lumbar right here, and so this is what L1 to L5, L1 to L5, okay. Then you have the sacrum, which is the lower back, which is 5 fused bones. So it's S1 to S5. Okay, I want to say it's like right up in here. So it's S1 to S5. Okay, this is the sacrum. You know, this is the area where when my dad injured himself at work. Okay. And my dad was a heavy smoker. Some family members said that knew him at best that he was smoking since he was age of 14. Some say he was smoking since the age of 21. I don't know. But I know in my lifetime growing up until the day he passed, he was a 3-pack a day smoker. Winston Light 100s. Yeah. 3-pack a day Winston Light 100s. And so it traveled. So up in the thoracic area, I'm just going to draw, you know, like this. You have his lungs, okay? You have his lungs. Let's go draw just like that, okay? And when I was in my senior year of high school, my dad injured his hip. So his hip would be right here in the sacral area. So I'm just going to put hip right here. And I use my dad all the time, okay? So this is his hip area. This is his lung area, okay? And so they did an x-ray right here in his hip, okay? They did an x-ray right there in his hip. And meanwhile, while they did an x-ray in his hip, they couldn't help, you know, because your torso is only so long, right? You're going to end up catching other stuff on that film. Am I right, Dr. Smith? You're going to end up catching other things on an x-ray film, and you want to see other stuff, which makes it kind of good. So then they said, okay, well, Mr. Glover, that was my maiden name, Mr. Glover, we see that you have some nodules. Okay, has some nodules. Now, anytime you hear the term nodules. Okay, it could be in the breast, it could be nodules in the throat, in your thyroid area, in your cervical area. That could mean that it's either benign or is cancers. Okay, metastatic is what they say. So when they told my dad that, and they did the X-ray of him, I'm going to do this in purple. So I'm going to make this an X-ray. When they did the X-ray of him, it caught it when he was trying to X-ray the hip, and by way of circumstance, so he was kind of like given a shot, a warning, if you will. So this was like, I think this was like 86, 87. And when they did that, then later on in 94, 94, he injured himself at work. And so those nodules grew. They metastasized. Metastatic is a condition of cancer. Okay, a condition of cancer. When it's metastasized, notice how I changed terminology, medical terminology. That means it has spread. Okay, so when it metastasized, then that means, let me do it in blue. I love color. Okay, when it metastasized, that means that the nodules formulated and the fluid of the cancer from the nodules went all the way down to his back into the sacral area. So what do you think happened there? It formed a tumor. Okay, this is what we call in situ. Okay. Okay, in the diagnosis world. In situ means that it started in one place, but it's found in another place. Okay, in situ. Okay, that means although the cancer was found here, doesn't mean that he has sacral cancer. It just means that it started somewhere else and it just happened to land there. And sometimes things happen. Okay, it's kind of like with gout. You know, I tend to release uric acid crystals. And so sometimes in the circulatory systems or the release in blood, the crystals goes released into the blood. It'll land in my hip. It'll land in my wrist. It'll land in my knee. Yesterday I woke up. I got off the bed. It was in my left knee. It was in my right big toe and my right ankle. I'm walking like this, like, oh my goodness. If I had some disco music, I'd be dancing, So I'm walking like out of the house, And so I had to pull out my handy dandy walker so I can get around the house and get around the church and stuff like that. Okay, so it kind of travels like that. So everything travels from the kidneys to other places in gout. It travels in the blood system. So where it lands in between the joints of your bones. And so for me, when it lands in the joints of my big toe, my ankle, my knee, especially my big toe and my ankle, it feels like I broke it. I've never broken a bone, but it feels that extreme to me, if I can imagine it. It feels that extreme. And it's just crystals. It's like little salts. Like kosher salt is like that, and it sits in between the joints. And oh my gosh, it hurts. Okay, so I had to drink like tart cherry juice and take colchicine and allopurinol and turmeric and carrot juice with ginger in it, and drink lots of water to help eradicate a lot of that. Okay, but getting back to my dad, so the tumor landed in his tailbone area, the sacral area. And so when he hurt himself at work, and the occupational doctor at his job, they hired an occupational doctor. So most of your construction sites, my dad was a welder, he was a construction welder. They have occupational doctors that deal with you right then and there, or they have clinics they send you to that they have contracts with, and they deal with you right then and there. And so when they do that, they took an X-ray. He brought home the X-ray and he knew I was in the medical field, so he allowed me to see it, and he asked me, what does this mean? What does that mean? What does metastatic mean? And I was like, see, back then in 86, I was 17 years old. So I was just learning my craft, in nursing as a nursing assistant. I was just learning my craft. So I really didn't grab hold to nodules, what that mean, working in a family practice office. It wasn't until I worked at MD Anderson. It was like, oh, in patient registration. We're going to talk about those kind of jobs again. But when I worked in patient registration, I got to reading the patient notes and what all they were coming in for, why they were being admitted, and learning all these extra, you're going to learn more medical terminology than you have in here. So you have to be a lifelong learner on Medical Terminology Island. Okay, so if you're going to live on Medical Terminology Island, you got to stay a lifelong learner. Okay. And so when I explained to my dad what was going on, and I'm like, oh my gosh. And he ended up having a biopsy, and he ended up having to get it found out he was stage 3 lung cancer. So that puts you in a much higher risk category of survival, if you will. Okay. But stage 4, oh my God, it's just like, I don't know. With stage 3, maybe you have a chance, but we'll see. And so what ended up happening to my dad, instead of them doing a needle biopsy, things have gotten a lot better these days than back then. They cut him open. And what happens when you cut a person open? It gets worse. Yeah. When those cancer cells are exposed to air, it spreads like wildfire. Okay. And it gets worse. Okay. And so when it was found out that, they did what? They cut up. What did they do this at? I don't want to say too much on the camera, but it was like, oh my God. And I talked to some consultants of this field, and they just said they shouldn't have done that, and he only lived 9 months. And chemo, radiation, it did all what it could do, but they shouldn't have done that. What they should have done was a needle aspiration, and maybe chemo would have helped it. Radiation, I think it would have helped his quantity of life, and it would have given him a much higher percentage of quality of life. He wouldn't have been at 100%, but he would have been suffering, yeah. But he would have lived a lot longer than 9 months. Okay. And so all that took place. But that's what that is. So cancer in situ, that means the cancer was found in the sacrum area, although it doesn't mean he has sacral cancer or cancer of the sacrum. It just means it traveled from somewhere. Sometimes you can get breast cancer, and the cancer can travel, if you don't deal with that, the cells itself. That's why when they did the right breast mastectomy, they took out 7 of my lymph nodes, and they did a biopsy immediately while I was still under anesthesia in the surgery. I think the surgery took about 5 hours or so. And so, she's in the wrong room. Is that Crystal? Or oh, no, that's not Crystal. It looked like Crystal, but it ain't. I thought it was. God, she looked like Crystal. Anyway, they had to make sure, that it wasn't cancerous in the lymph nodes. If it's cancerous in the lymph nodes, then that means that they have to take out more lymph nodes out from under my arm. Okay. So by the grace of God, it was only 7, and they didn't find any cancer in my lymph nodes. So it was very confined in its place, and they were able to marginalize further outside the circle of the cancer nodules and remove the cancer itself. So I didn't have a lumpectomy. I opted for a mastectomy and a unilateral. Unilateral means one, bilateral means both. Okay, so I just got one, my right breast. And so when they removed that, that really helped a whole lot. It eased my mind, because all I could think about if they did a lumpectomy, all I could think about is What if it comes back? What if it's hidden in some more of that tissue? What if that? I didn't want to chance nothing. I'm like, just take it. I'll just deal with prostheses and whatever to make myself look good. Okay, so anyway, so that's how that works. Bless your hearts. Thank y'all for listening. Then we have the coccygeal tailbone. Okay, the coccygeal tailbone. So it's 4 fused bones. So you really can't give like a number 1, 2, 3, or 4. Okay, so it's coccygeal. So let's put on here coccyx. Okay, now let me say how cancer coccyx. How you spell that?
C.
Okay, thank you, sweetie. Sometimes a person in this area can get rectal cancer. Okay, rectal cancer, CA. CA means cancer. CA means cancer, so you may want to write that down. Okay, so you're looking at all of this. Miss Harper is all over the page, but what I'm trying to do is bring it all together. So as you're learning this, I know it's going to seem monotonous and boring. It's like, this word means that, this word means that. But if I could bring it all together to you in a page, then you understand how important it is. Okay. So if a person has rectal cancer, sometimes, again, here it is. Where's the lower back region, lower waist? Okay, so in the lumbar. So let's go right here in the lumbar. So you have the intestines right here. Okay, and the intestine, everything goes out and you poop. You poop right there. Okay, so you have the small intestine, you have the large intestine. Okay. And so through all that, sometimes people have what they call colon cancer, colon, intestinal, colon cancer. Okay. And that colon cancer leads all the way out. Sometimes a person may get hemorrhoids. Anybody ever been? Okay. Ouch. Preparation H, tubs. Okay. All right. I'm a testimony. Okay, so hemorrhoids, okay? So all those things play a beautiful role. If you pay attention to your book, like anything else, when I was teaching kindergarten, when I teach math, let me give y'all an example, just like anything else in life, everything is learned in layers. Your education book takes you at a pace from beginning to end, but in layers. Okay, so you're going to learn it in such a pace where it's like it's going to all come together at the end. When you get to the last chapter, it's going to all be one big, beautiful puzzle. Okay, all right. So moving on, page 54. Okay, so we see a nice, beautiful diagram here. And planes of the body, page 56. Does everybody see the planes of the body? Okay, so now you have the frontal plane, okay? The frontal plane, and it slices between the 2 arms here. See that? So all this is my frontal plane. So in the operative report or in the assessment part of the notes, sometimes of the patient, the doctor may dictate a letter. You okay? The doctor may dictate, okay. Oh, your shoes are cute. I love them. Okay, sweetie. Sometimes on the frontal part, you're going to read in the dictation notes, transcriptionist. How many of y'all like to type? You want to learn? Okay. As soon as Miss Lady can bring us our machine in here, we'll have y'all doing some of that. Maybe we could do it after lunch. Hopefully we can find.
Have started the typing per minute.
Yes.
45.
Yes, 45 per minute is average. And it's not hard to attain. And I'm gonna take y'all on a free, see, she can
need to type 60, so 45 is not bad.
Yeah.
I was
Yeah.
testing myself and I was at 33.
Okay, well you got how much more to go? 12? Okay, you can do it. You can do it. So we're gonna have y'all doing typingtest.com. So that's gonna be the next thing we're gonna have y'all working on. Typing test. You can create the account at home if you want to. It's free on the internet. And typingtest.com is what it's called. Typingtest.com. And just start practicing. But every morning that you come in, eventually we're gonna have where y'all work on that first 5-10 minutes of the morning, and then you email me your results. So if y'all want to do that at home and email me your results, that would be awesome. So I'm gonna write that over here. TARAN.Harper@hccs.edu. Okay? If you want to send that to me, that'd be super fantastic.
How do we get a school email?
I think you call the IT department and they'll explain to you. Do y'all have the number to the IT department?
I have it on,
Your phone?
not on my phone, but, on the computer.
Oh, okay. What did you say, Shaylee?
I have one already. I'm connected to it. So I've been taking classes.
Okay.
So,
I'm sure you have one. I just don't know how to get to it. I don't know how to tell you how to get to it.
Because mine is my number.
Your W number?
W number
and
and
student HCC.edu, but I needed the password to it because I can go on there and get Word 365
Yeah.
for free.
Yeah.
Yes, but I couldn't get into the account to get the
Yeah.
verification
So being a
code.
student, they'll give it to you free.
Yeah.
I was paying for it for like a year.
Yeah, you can go on there. It'll say student.
But it asks for, I know, like a code or something.
Yeah, you have to get a verification code from your college email.
Okay.
So
Okay. Let me write the number for the IT department, and then that way y'all can call them about that, and they can walk you through. And we'll work on that today after lunch. We'll just spend the after lunch break on that today. Okay? So that way y'all can have all that resolved and be able to do that when y'all start coming in. Okay. Hello. Oh, I've been an hour and something on this thing. What time is it? 10:37? Okay, so let me end right here. You know what? I'm just gonna let it all the way till 11 o'clock for lunch break. Okay. Now let's look at the frontal plane again on the assessment part of the SOAP notes. It's really important that you all understand the frontal plane of what they're talking about. They're talking about the front part of the body, okay, the coronal plane. The vertical plane divides the body and body parts such as organ into front and back portions, okay? So again, like the doctor on the show, the good doctor, he's looking at everything in a picture of his mind. You know, you have to go to the imaginary of your mind. That's what we used to do kindergartners. You have to imagine in your mind, imagine in your head. Okay. Now, number two is the sagittal lateral plane that divides the body or organ into right and left sides, right and left, right and left, okay? Which is the mid-sagittal plane that divides the body vertically into right and left halves, okay? Number three, which is the transverse plane. It divides the body or organ into upper and lower portions, okay? As the cross section. So thinking of cutting into a loaf of French bread and into circular sections. What a way to explain that. Okay. So anybody ever cut bread and then the bread has holes in it, right? It's kind of like looking at the organ, where the organ sits, if you will. Okay. So knowing the planes of the body is helpful, and in looking and imagining the studies such as X-ray films, radiographs, computed tomography scans. Okay, so here we are. We're looking at some of these things here. Okay, very good. Now, we're dealing with combining forms, abdominal, antero, broncho, cervical. I'm on page 59. Page 60, it continues with some more of that, so we'll come back and visit that. Page 61, we got some more of that. Page 62, page 63, and then we have CT and MRI. Now, computer tomography and magnetic resonance imaging. Again, if you're going to be a medical biller encoder, you can be a medical biller encoder for the radiology department. You have to know all of these procedures, terms to understand what procedure took place, what type of diagnosis happened to the patient. So I'm going to let y'all go back to page, what was that page here? Go back to page, well, let's start back to page 50 and work as much as you can all the way up to page 67. I'm going to go talk to the librarian and see if she can bring that computer thing over and see if we can get y'all going. I'm going to let y'all get to work on that, okay? All righty. I've enjoyed y'all. Did y'all have any other questions for me? Okay, great. All right. Well, this ends the video for Chapter 2 of the Ch.2 book in the medical terminology class. Thank you so much for joining us today on the THCOD channel. And remember, this is defining a better you for your health information. Thank you so much. Have a wonderful day.
I was just sitting here thinking, and I was